If you're a family doctor resident currently experiencing limbo, when you talk about limbo, it's like, am I really uh, decided in completing this journey? Am I really ready to start? If ever, let's say, for example, you're a first year, am I ready to start this journey as a family medicine resident? There are a lot of questions when you enter residency, and I do agree, residency is tough. It's never a walk in the park, and it's never an easy task. Let's say they always tell other medical students, oh, madali lang ang family medicine. But to be honest, it's quite different from the other specialty. For me, I started as an internal medicine pre-resident. It didn't last long. It didn't last long. Just around 2 weeks or a week. Then I didn't continue. I took up moonlighting, and I saw potential. I was earning, but there was no growth. 6 months, no growth, until I decided to take family medicine residency. It was my wife who encouraged me to take up family medicine. So that was, I guess, that's destiny, because my wife was the one who invited me in their training institution at Cagayan Valley Medical Center in Tuguegarao City. So maybe that's one of those reasons. I met my wife, my longtime partner there. Well, and also my love clinic works or clinic duties. I have more fun with primary care rather than in hospital cases, because primary care is usually, it's not that simple. They often say it's just cough and colds, but it's not just cough and colds. You have to reassess your patient. You have to screen the patient to make them better, and to hope that they won't get admitted in the near future, because preventive care is also part of our arm. And aside from that, primary care tends to be more meticulous in history and physical examination compared to other specialties. Yes, we see patients under the pediatric group. We know the history is very long also in pedia. We also provide them the similar pattern of history and physical examination. But take note, we don't just dwell on pediatric patients. We also see women's health cases like pregnancy, okay, or prenatal care. We do that. We also do adult history and physical examination, and we also do geriatric physical examination as well as clinical history. We see patients from womb to tomb. That's the gist or the overview of the scope of a family medicine practitioner. Or let me correct that. We don't use practitioner anymore. Physician. Or we don't use provider. We use physician. Because we have a large scope. In other countries, we call ourselves the generalist, general practitioner, the GP. And the GP is very much vast, learned, meaning a lot of skills is needed for you to be a GP, and they are well respected. Okay, as a family doctor, you need to be more keen, okay, in identifying some conditions that are sensitive in a specific population. Like for pediatrics, you need to know the common cases. You need to know the preventive care measures like your vaccines. For pregnant pregnant women, you need to do the prenatal care. You even do some procedures that are office based, because not all the time you need to go to the OB for consultation unless it's near the delivery date or the due date. You know. We can also do simple minor procedures. Like in surgery, we can also do casting, especially if it's just a simple fracture and it's just a primary care level. We can also do well, the usual adult history and physical examination, and we also provide counseling. That's a vast way of there's a vast array of services a family doctor can provide. And mind you, a family doctor can see or manage or facilitate the day-to-day transaction of a rural health unit, a municipal health unit, okay, or a municipal health office, a provincial health office, a government facility that is primary care based. Okay, a family physician can facilitate or do the day-to-day operations of a, we call it a bukas center or an ambulatory care center. Okay, and also a family physician is well versed in doing not just primary care and healthcare services. We do leadership roles, administrative roles, research, and also health education. Okay, and in that scope that I mentioned earlier, from the very start, from pediatrics down to non-medical costs, that's non-medical concerns. That's the real scope, and it's just the tip of the iceberg of what a family doctor can do. That's why it's very intriguing how our country can fully implement universal health care, even though we had family doctors ever since 1960. So the problem there is right now, healthcare has been distributed vastly within the specialist or the specialty societies. More like, say for example, if your patient has cough, you often go directly to a pulmonologist rather than a primary care provider, which is in universal healthcare. It should be for a GP or a healthcare provider or a healthcare doctor, a primary care doctor, you know, before you go to the specialist, because that, my friends, makes the cost of medicine more cost effective. Because in the other countries, the specialists like your pulmonologists and cardiologists often um, provide payments that are a bit higher compared to the general practitioners or the general physicians. You know, so when we want to implement universal healthcare, it's important that we start first with primary care, and primary care can be manned by a family medicine doctor. Okay, so for the things that I mentioned earlier, if you're stuck in the limbo, in the middle of your training, or in the start of your training, it's okay. No, later on you'll get your wind. Later on you'll get your drive, your motivation to move forward, because there are a lot of things you will learn moving forward. You just have to um, keep up with the flow, have people that can be um, helpful in teaching you the better ways of becoming a good family doctor, have a great mentor or approachable mentor, okay, someone that can be a senior to you, that can help you around navigating how your patients should be managed properly, and accompany people that can be influential in your growth and influence them, okay, for their own growth as well. It can be a different specialty, not just a family doctor. You can have friends from internal medicine, you can have friends from OB, you can have friends from radiology, and you support each other. That's the very gist of residency. Supporting each other will always be one of the best solutions for you to survive and finish your training. If it's a family doctor, better, because you both experience the same challenges. So better if you have someone within the same specialty. Okay, support each other. Just like me and my wife, we supported each other until graduation and until the exams. So don't don't drop the ball just like yet. No, don't drop the ball just yet. Think it out. As a family doctor, you have potential. You chose this specialty not just because you think it's easy. Reposition your thoughts. Maybe you chose the specialty because there's potential. There are a lot of potential. You just need to ask the right people to know which or what potential does a family doctor, okay, has in the future. Maybe in this country, maybe outside this country, maybe in the hospital, maybe in the clinics, maybe in the academy, maybe in research. So that's up to you. Why did you took up residency in family medicine in the first place? Always recall your purpose. Always remember the first day, okay, of your training. Ano ba yung ambition mo? Okay. If your ambition is to earn money, being a doctor is the right profession. Okay. If your ambition is to heal the world, well, technically, healing the world has a lot of things to consider. A doctor can do that. Some other professions can also do that. Okay. A theologian, a priest can also do that. They're spreading messages, right? So it's up to you how you make your profession glow, how you make your career grow in the future. Okay, so it's just a reflection, and I hope if anyone's listening, if a future doctor is listening, try to think out what was the purpose why you took up that training, specifically family medicine residency, in the first place. Maybe baka mahimasmasan tayo. And congratulations in the future. I know you could finish what you started. Yun lang naman. Hopefully, maganda-ganda rin naman yung outcome nito in the future. Again, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life.